Hello students, welcome to the program Bachelor of Arts first year, subject Psychology, semester 1, paper title Child Psychology. I am Assistant Professor Maria Fatima de Costa and I will be presenting to you on the topic Birth Process and Methods of Childbirth from Unit 1, Introduction and Early Beginning of Life, Module number 5. The outline of today's presentation is 3 stages of birth and methods of childbirth. At the end of the presentation, you will be able to describe the sequence of steps that take place during the childbirth process. You will also be able to differentiate the different methods of delivery. So let's begin with what is the birth process. The birth process is divided into 3 stages. Stage 1 is the longest stage, which lasts for 6 to 12 hours. It begins with uterine contractions, which are 15 to 20 minutes apart, and they last up to 1 minute. These contractions further increase in frequency, intensity, and they appear every 2 to 5 minutes. The contractions cause the cervix, that is, the opening of the uterus, to stretch and open the birth canal to about 4 inches. Stage 1 ends when the baby moves from the uterus into the birth canal. Stage 2 lasts for 45 minutes to about an hour. It begins when the baby's head starts to move through the birth canal and the cervix. It ends when the baby finally emerges from the mother's body. During this time, the contractions come every minute and they last for a minute each. With every contraction, the mother's task is to push the baby out of her body. Stage 3 is the shortest stage of all the 3 stages, and it lasts for about a few minutes. This stage is also known as afterbirth. It is painless, and in this stage, the umbilical cord, the placenta, and other membranes are detached and expelled. In this figure, you will see the 3 stages of childbirth. We now move on to the methods of childbirth. A pregnant mother can choose from a variety of childbirth practices. These include use of medication, non-medicated techniques, and cesarean delivery. Medication involves the use of drugs. These include anesthesia, used to block sensation or consciousness during delivery. Analgesia relieves pain, and oxytocin is a synthetic hormone that stimulates contractions. Remember that a stronger dose can decrease the pain, but it can have a negative outcome on the fetus. The second method of childbirth is called as natural childbirth. The aim of natural childbirth is to reduce the pain through education about childbirth. The objective is to help decrease the fear, to provide reassurance and confidence to the pregnant woman. She is taught breathing and relaxation techniques along with a partner who assists during the childbirth process. The next method of childbirth is prepared childbirth. This method is also called as the Lamaire's method. It was developed by French obstetrician Dr. Ferdinand Lamaire's and includes a special breathing technique which is taught to the mother to push the baby during the birth process. Both the mother and her partner are educated about anatomy and physiology. Anatomy is the study of the structures of the body, while physiology is the study of the functions of the structures of the body. In this method of childbirth, the woman is taught to be in control in the delivery process. The father too plays an active and supportive role. The final method of child delivery is called as cesarean delivery. This process makes use of surgery to remove the baby from the uterus. The procedure involves an incision which is made in the abdomen. Cesarean delivery is also called as cesarean section or the C-section. Cesarean delivery is used in the following situations. Firstly, when the baby is in the breech position, that is, with bottom first or feet first moving towards the birth canal. Secondly, it is used to avoid any kind of respiratory problems and when the mother has health problems. When there is less room for the baby to pass through the vagina, this method of delivery is employed. And finally, it is used in the case of multiple births. So let's summarize what we have learned in today's lecture. We have covered the following topics, that is stages of birth and methods of childbirth. We have learned that there are 3 stages of birth and how one stage differs from the other stage. We have also learned that a mother has the choice to choose the type of birth delivery that she prefers from a range of methods of childbirth, which include medication, natural childbirth, prepared childbirth, and cesarean deliveries. We have come to the end of today's presentation. You can refer to the books Child Development by J.W. Sandrock and also Child Development by Ellie Burke for further references. Thank you.